Hi, this is Dr. Dorsch from Forest Hills Family Dentistry. We're going to go over how we use cone beam technology to scan and treatment plan for implant therapy with our patients. One of the biggest advantages to cone beam therapy is having a three-dimensional look at all the anatomy and being able to plan exactly where the implant is going to go to replace the missing tooth. This patient here is missing a couple teeth. Here's one area. This area they're missing a couple molars, and what we've done, this is a two-dimensional representation of what we're trying to accomplish. The blue here that you see is the outline of a proposed crown that we've imported with our CEREC technology. The orange here is our simulated implant. If we look at this in two dimensions, this would appear that that implant would be into this purple line, which is where the mandibular nerve or the jaw nerve sits, along with a big artery and a big vein. You don't want to put the implant into the nerve, as that will cause permanent numbness and a lot of discomfort. So let's look at this in three dimensions and see how we can use this to our advantage. This patient is scanned, which takes about 14 seconds, and the 3D reconstruction is built off of that. And you can see here we've mapped the nerve out in three dimensions, and then we put the implant based on where we want the final crown or the final tooth to be placed in there. Looking at it from all dimensions, you can see here, if we zoom in a little bit, you can see the implant misses that nerve pretty well on this particular scan. So let's look at this in a cross-sectional view. You can see here, this is the implant in the cross-sectional view. If we were to get too long with the implant, you can see where the implant would actually go outside the bone, and that would cause failure and damage to the sublingual gland or the salivary gland that sits under there. You can also see where that implant may get into the nerve and cause some permanent damage. So the idea is to keep the implant centered underneath our final restoration, which is the blue outline here, and to keep it contained inside the natural anatomy of the bone and the proper height and width here. So you can also appreciate this patient has lost a lot of bone on this angle. The bone used to be about here to here. So we've got the implant placed appropriately. Let's look at what happens when it's not placed using 3D scanning technology and a two-dimensional scan where you would place the implant kind of freehand. This was the case that was sent to us here. You can actually, this is in the upper, this is a front tooth, and you can see this cross-sectional x-ray of where the implant has gone outside the bone, where it demarcated by this yellow arrow. As that area, this patient presented with very swollen gum up above the implant and an actual loose tooth. So you can imagine this patient, after spending lots of time and money, having a front tooth that had to be removed, and then this implant had to be removed, and all the bone where this implant had penetrated had to be grafted back in using their own bone from their hip. So that's a very involved procedure, and it takes about 6 months to heal and for the graft to be accepted. And then a new implant has to be placed at the proper angle, which would be followed by my mouse about obviously centered in the height and width of the bone. With the 3D scanning technology, we can really avoid these complications. We know exactly where we're going before we go in there, and we can do these cases. An implant like this is done in about 15 to 20 minutes with very little local anesthesia, and it's able to accomplish all our goals of getting that implant exactly where we want. Once the implant is placed, then about 3 months later, we go ahead and restore it, again using fully computer-guided technique and getting that restored. And you'll see that in a later video under our CEREC heading.